She goes ahead to say that worse is that we cannot assure that every baby born stands a fighting chance celebrating their first month of life. Madam Speaker, in all our communities, averagely, people are able to applaud the standards of that community by the well-being of the women and children that are in those communities. In my own village, Madam Speaker, and not for any reason, men are judged by how well the women around them are kept and how well the children they raise are kept. On the same note, Madam Speaker, even if you are what kind of man and the women around you are not kept well and the children around you are languishing, Madam Speaker, communities do not consider you as any considerable person to be notified. And Madam Speaker, we must then intentionally we must be intentional in reducing the preventable maternal deaths. Madam Speaker, just in December, and I know that is the story everywhere, Madam Speaker, we lost some young, and incidentally they were students from college in my local sub-district hospital. We lost 2 young girls when they were giving birth. We lost the wife of a young teacher, a promising young mother, leaving behind 3 children. That was a Mrs. Opio, who walked into a health center called Ongako in Dewa sub-county. She walked. She had prepared herself, and she walked to the hospital. In less than 1 hour, Madam Speaker, Mrs. Opio Milton was pronounced dead. Just the previous weeks, we had lost Caroline Orowe, who is a student, and another young student. And so, Madam Speaker, that is why we must be intentional. That how do we improve our services? How do we improve our services that are given by both levels of government to ensure that we reduce maternal death? That, Madam Speaker, even as we celebrate as a country, as we celebrate the records of increased antenatal care, visits, and attendance in our hospitals, Madam Speaker, these attendants and the skilled birth attendants and the indices that are recorded in our records in hospitals, Madam Speaker, it is worth noticing that these impressive records, these impressive indices have not translated to reduced maternal deaths in our country in the 21st century. And so, this bill, Madam Speaker, is a bill that will take this country, Madam Speaker, will ensure that the status of maternal health care goes to the required international standards. Madam Speaker, I also could give a brief demographic health survey that was done in 2022, which, if I'm not wrong, may be the latest, about percentages in our counties. And if I read them out, you'd see that other than Nyeri and Nyandarua that are at their lowest, a number of our counties are not doing well. Madam Speaker, this brings me to a statement that an economist gave out, that if we have invested so much in bringing our mothers and girls to the hospitals and dispensaries, Madam Speaker, then why are our girls and women still dying from a natural activity as childbirth? Madam Speaker, there are concerns that must be addressed as a country. And Madam Speaker, it is a time to work on the quality of our service provisions. Some of the concerns, critical questions that we must ask ourselves as a country is the service we are providing meeting the minimum quality standards? Madam Speaker, I bring these concerns because as a country then, we must address the issue of the mothers that we continue to lose, the girls that we continue to lose. Other concerns are our facilities that we have in the dispensaries, in the healthcare centers, in the hospitals, in the referral hospitals. Do they ensure the highest attainable standards of care? Madam Speaker, do we have shortfalls in health systems, health system financing models? What are our models of financing health? Do we have an adequate workforce that is available for patient care? And Madam Speaker, the workforce must be looked into in terms of numbers and in terms of the skills that they have. We must also address, Madam Speaker, probably a non-responsive health information system. Madam Speaker, we really cannot expect different results, yet we continue to do things in the same old manner. Madam Speaker, it is about learning and unlearning what we have. And Madam Speaker, this bill, the Maternal, Newborn, and Child Health Bill, as I indicated when I began to move it, is in part 1 that talks about the preliminaries. Those are just interpretations that are in the bill. The bill, Madam Speaker, has the short title that may be cited as the Maternal, Newborn, and Child Health Act 2013. We have the interpretations in the bill, the objects of the bill, and Madam Speaker, the objects of the bills are in, 1, they provide a framework for the delivery of these comprehensive health services that will meet the needs of mothers, the needs of newborns, the needs of children. Madam Speaker, in the objects, it establishes a coordinated and structured system for the provision of these quality services to maternal, newborn, and child health care services. Madam Speaker, we go to clause 4 and you see the principles for service delivery. What are the major principles of service delivery? I'm talking about access and equity. How do our mothers, the maternal, the newborn, and the children up to 12 years, do they have access? And are these services equitable to these cohorts? Madam Speaker, the principles include access to services. Are the services timely when they need it? Madam Speaker, when I refer to the loss we had in Sindo, in Homa Bay District Hospital yesterday that was referred to Sindo, you probably think about a mother that did not have a timely services. Probably somebody did not ensure the kind of service this woman needed. So, Madam Speaker, the principles talks about access, equity, talks about timeliness. Another principle, Madam Speaker, is the collaboration between the national government and county governments and the relevant stakeholders. Madam Speaker, health is a function of the county government. Health is a shared function. This bill spells out what are the services that the county government must give to our mothers, to our newborns, and to the children up to 12 years. We are talking about inclusivity in delivery of health services. We are here spelling out in the bill the recognition and the sensitivity of the cultures of various communities. Madam Speaker, this bill talks about targeted empowerment and capacity building initiatives to people both at risk and persons with special needs. And Madam Speaker, it is worth noticing when you talk about people with special needs, that these are individuals with additional health needs and requires assistance above the regular health needs and the general population. We are here referring to the mental. People with mental health, those are additional needs. I'm here talking about people who are psychologically challenged. We are talking about people who are marginalized. We are talking about the disabled. There's a whole clarification of people with needs. Madam Speaker, when these people with special needs are pregnant, who, other than the fact that they could visit the health center, who follows them to ensure that they are getting the right services that is required of them? Madam Speaker, often in our urban centers, even small markets, you see even women that have mental challenges. By local standards, people call them mad, a mad woman. But you see them, they are human. They get pregnant. But who ensures that this woman attends all her clinics? Who follows up on these special need groups to ensure that they visit the hospital for all the period? Madam Speaker, this bill refers to this group of people with special needs. And Madam Speaker, on clause 5, that is on part 2, we are talking about the right to health services. And I want to emphasize that this right insinuates that the services must be timely. The services must be appropriate to the person in need. The person must be treated in our health centers and in our health facilities with dignity, with respect, and with privacy, Madam Speaker. Some of the rights to health services in these bills include emergency treatment and essential medicines. They must be entitled to attainable state of mental and physical health. And Madam Speaker, this right to health services includes promotive care, preventative care, rehabilitative care, and curative care, Madam Speaker. All these are spelled out in clause 5. And for the enjoyment of this right to maternal, newborn, and child health, there are responsibilities that are spelled out for the national and county government. Madam Speaker, we know health is a shared function, that county governments have their share, their role, and national government have their role. And these roles are spelled out in clause 5, is that for the enjoyment of the right to maternal, newborn, and child health, the national and county government, Madam Speaker, shall respect, protect, and fulfill the right to maternal, newborn, and child health, and guarantee a mechanism for its enforcement, Madam Speaker. Madam Speaker, clause 6 spells out the services that must be given for non-pregnant women. And Madam Speaker, we say that pregnancy is a noble occurrence, but there must be an environment that is conducive for that pregnancy. And clause 6 spells out some of these mandatory services that a non-pregnant woman is entitled to. They include and are not limited to preconception care services as may be prescribed, Madam Speaker, from time to time. There are appropriate counseling services. If a woman needs those services, they must be counseled and be prepared for pregnancy, Madam Speaker. They are entitled to health information and education, Madam Speaker, as they make even the decision to be pregnant. They are also entitled to referral for certain services that are not limited to services like adoption. And Madam Speaker, the Cabinet Secretary may prescribe standards for the effective delivery of these services regarding the safe occurrence of future pregnancy. So, Madam Speaker, it spells out the services that a woman who is non-pregnant are entitled to. Then it goes ahead to prescribe services now that a pregnant woman are entitled to. And Madam Speaker, the Cabinet Secretary shall put in place measures to ensure that there's access by every pregnant woman to health services. The health services under this includes, Madam Speaker, early detection of pregnancy. The women, while pregnant, have a right to know as early as possible that they are pregnant, because then there's special care that they will require. Madam Speaker, they are entitled to free prenatal care, referral to childbirth preparation classes, Madam Speaker. Madam Speaker, if you talk to most of these young women, you'll realize that at some point, nobody even prepared them for childbirth. There are some who, when they give birth, they do not even know how to handle a child. And Madam Speaker, these women require that kind of preparation because those children also are entitled to care that is of quality. Madam Speaker, they are also entitled to referral to adoption services, to healthcare services in the intrapartum period, to healthcare services during the postpartum and postnatal period, Madam Speaker. There must be a training of even feeding and care of infants, including breastfeeding support practices, Madam Speaker. As I talk about this, Madam Speaker, a number of people might assume that those are skills that people just get to know naturally. Madam Speaker, we are in an era where our young girls because of school and other current activities, do not even live. Long time, women lived with grandmothers, and grandmothers would train them on some of those care. And Madam Speaker, we do not want to assume, and that is why this bill spells out those services. Madam Speaker, it is on this note that we are even applaud the Linda Mama initiative, and we want to encourage that it goes on because it has been a relief so much to our women in the past. Madam Speaker, on this, we go to the services of neonatal, the period and children, and services that children under 12 years are entitled to. And it spells out, Madam Speaker,